The UK is stepping up efforts to fight COVID-19 as the number of cases and casualties keeps climbing. But as the country grapples with its new reality, signs of anti-China sentiment have also been on the rise. What's the story? And a team of Chinese medical experts was dispatched to Serbia to help in the fight against COVID-19. What's the view from that battlefront? And how are China and Serbia working together in this global crisis? Welcome to The Point, an opinion show coming to you live from Beijing. I'm Michie. The UK Prime Minister Boris Johnson was admitted to the hospital over symptoms of COVID-19 on Sunday. The same day, Queen Elizabeth II delivered a rare televised speech calling for unity and resolve as her country fiercely fights the outbreak. The UK has reported over 47,800 confirmed cases as of Sunday and over 4,900 deaths. Some are wondering if the country will become the next epicenter of Europe. But as the UK grapples with its new reality, some politicians and those in the media have ramped up attacks on China. What's the latest, and how might a rise in anti-China sentiment play into bilateral relations in the near future? Joining me for the discussion from Edinburgh, Scotland via Skype is Alistair Michie, Chairman of International Board at the Centre for China and Globalization, and on the phone in Beijing, Professor Hongjian, Director of the Department of European Studies at the China Institute of International Studies. Gentlemen, welcome to The Point. So, UK Prime Minister Boris Johnson has been admitted to hospital after experiencing persistent symptoms of coronavirus. Now, Downing Street indicated that the Prime Minister was admitted to hospital on Sunday on the advice of his doctor after continuing to exhibit a high temperature. We hear reports, Mr. Michie, that the Prime Minister will just spend one night in the hospital. What's the latest situation you have heard, and how has his infection and possible deterioration of the situation impacted the UK people's morale in its fight against COVID-19?
Well, Lucien, it's deeply worrying that Prime Minister Johnson has had to go to hospital. The reports that I've heard during today are that it is not clear just how unwell he is and when he may be released. It couldn't happen at a worse time for the UK, when we need a strong leadership and clear direction from Prime Minister Johnson. So, I mean, we all obviously wish him well and a speedy recovery, but it is of deep concern at this point of crisis for the UK that we do not have the Prime Minister fit and well and leading the nation.
Of course, I believe that concern is shared by many people here in this part of the world as well. Well, on the same day Boris Johnson was admitted to hospital, Queen Elizabeth II gave a rare televised address to the nation. She delivered a message of hope, saying, if people remain united and resolute in the face of the outbreak, we will overcome it. And this is noteworthy because it's only the 5th time that she has given such an address in her 68-year reign. So, Mr. Michie, why do you think she decided to come out and speak at this time, and what kind of effect has her speech been having on the sentiments of the general public in the UK?
I think you're right, Lucien, that this was quite exceptional in her long reign, and the fact that she did make this televised broadcast last night is a measure of the seriousness of the situation for the UK. In some of the points you've made already about suggesting where the UK is at this point in time, I think it's very difficult to come up with an accurate picture of exactly where things are heading in the UK. I don't fully trust the figures about the numbers of people that are reported as being having the disease or the number of people dying, because it depends entirely how you measure this. And it's quite clear from what I've read that many different nations are measuring in different ways. What is clear is that the UK was very slow in reacting and preparing. It did not pay attention and learn from the way that China dealt with the crisis when it broke. And we're paying the penalty and the price now. I think the key is to watch in the coming weeks whether our National Health Service becomes overloaded. At the moment, it appears, from the reports I can see, the hospitals are coping. But what we obviously want to avoid is a situation like in northern Italy, where the health service and the hospitals became overcome and overwhelmed. It's too early to know whether the late preparation of the UK is going to overwhelm our health service. I hope it doesn't.
Hopefully, yeah, that will be the case. Again, don't want to criticize anybody, don't want to point fingers, but purely to find out the reasons behind things, Mr. Michie. Why do you think the decision was taking so long to make for the British government? Was it because that they wanted to take a very cautious measure, a very rational measure? Because the way that China went was very drastic, but also very costly way. You know, it literally paralyzed the entire province with over 60 million population, and large parts of the economy of China was just, you know, put to a standstill. So maybe was UK hesitating between a more reasonable and a more sustainable way of fighting this virus?
No, I think that the reasons why many of the nations outside China were slow to react was because you've got to go back to SARS. SARS had a huge impact, as you know, in China, in Hong Kong, in Singapore, Taiwan, Korea. But it was largely localized there. It didn't spread beyond. And that it's particularly, I think, interesting how Taiwan prepared post-SARS. It learned deep lessons from SARS, and it reorganized its health service accordingly. Unfortunately, in the high-income countries, particularly in Europe and North America, they have a very closed mindset to what is happening in Asia and in China. They have their eyes shut, they have their mind shut to what trends that are going there. And therefore, they did not learn the lessons from SARS. And they were therefore hugely unprepared and slow for when this extraordinary catastrophe started to spread around the world. So I think that the lessons, the root of it, that Asia learned from SARS, Europe and North America certainly did not.
Professor Cui, let me go to you. As I said, it seems that the UK has been particularly hard hit, as the case mortality rate is very high, actually the highest, according to some tally, as high as 12.4%. The number of death toll, the number of casualties is also very high, the fifth at this moment after Italy, Spain, the United States and France. So why do you think, observing from your perspective, why do you think the UK has been hit particularly hard?
Yes, maybe it's not as
I said.
Sorry, Mr. Michie. Let me go to Professor Cui here.
Right, okay, no problem.
Okay, so now maybe it's not the right time to make some conclusion about how it is behaviors or how it is policy of British government to deal with this coronavirus. But we can find out even some information, and we can get some review about it. Firstly, I think that not yet, especially at the very beginning of this coronavirus, the British government did some preparation well, I mean, for this issue. I think firstly because at that moment that the government, British government, just took the coronavirus as another kind of flu. So it's a lack of a lot of the knowledge and also especially preparation enough to deal with. Of course, another issue is about maybe a political issue, because also, shortly after the coronavirus in Europe, at that time, the British government was preparing for the second stage of the negotiation with the European Union. So I think it was very difficult for the government to change the focus from the Brexit to another kind of, a very big crisis. And the third, I think maybe one of the very important reason is, as we know, for the NHS, the National Health System in UK, it used to be provided, by government and people, and with a free for all for a long time after the Second World War II. But now the question is since 2010, and there are a lot of shut of the hospital or some the beds in some hospitals. So I think it gives a very, very lack of capability of the British government to deal with drastic attack from coronavirus.
Okay. Well, I'm sure there will be a lot of discussion about exactly why the situation has caught the UK off guard. But strangely, there has been some uptick actually in blaming China sentiment, let's say, if not anti-China sentiment, coming out of some politicians and out of some people in the media. We have been seeing, for instance, UK Cabinet Officer Michael Gove on Sunday blamed Beijing for stymieing Britain's response to the pandemic, saying some of the reporting from China was not clear about the scale, the nature and infectiousness of this. And then Foreign Secretary Dominic Raab on Monday called for a lessons learned review in answer to a reporter's question about China's obstructionism. And Ian Duncan Smith, a member of Parliament and former Conservative Party leader, cited Beijing's coronavirus cover-up as the final straw that should prompt Britain to rethink its relationship with China. So, Mr. Michie, what has been your impression of the kind of information coming from China concerning the scale, nature and infectiousness of the virus? Was the message coming out of China clear to you, at least?
I, first of all, would like to say that I thought that the comments from the Ministers Gove and Raab and the former Minister Ian Duncan were very, very misguided. I personally don't think that they are representative of mainstream thinking. I think a lot of people are beginning to think that this is a global catastrophe and that it needs a global response of cooperation and collaboration. And I have been very pleased to observe how China has reached out to many nations, sending medical equipment and medical staff. I think this is much more the approach. I think also what is I find deeply worrying is that there has not been the same reaction as in 2008, where the 2008 financial crisis, that triggered the first ever global level meeting of national leaders in the world. And they came together and they were very effective. And I think there's a consensus that the way that they operated helped to rapidly de-escalate and remove the problem, the real problems of the financial crisis. This is not happening now, and it is deeply worrying that world leaders are not acting and working together. And it does not help at all when there are misguided attempts by some ministers to attack China in these circles. Very dangerous, very unwise.
And I guess that's why China is forced to come out with a complete rundown of all of the international cooperation China has been undertaking since the epidemic started in Wuhan at the end of last year, to show to the world what China has been doing step by step. Because on various occasions I've noticed
the problem is, Liu Shen, is that the way that China has been communicating, I have said this repeatedly and repeatedly over many years, how China communicates inside China does not work outside China.
Okay, now China is trying to do it. Now China is trying to do it very differently, and it just came out via Xinhua, both in English and in Chinese, a very detailed timeline. And I want to use the remaining limited time I have to share with our audience. For instance, late December 2019, Wuhan CDC detected cases of pneumonia of unknown cause, and then on 30th of December last year, Wuhan issued an urgent notification, which was released on the internet. On January the 1st, the National Health Commission set up a leading group to determine the emergency response to the epidemic. On January the 3rd, China started regular briefing to the World Health Organization, relevant countries and regions, including the United States, and I would say the UK would be also included. On January the 4th, Chinese CDC leader phoned US counterpart about the situation. On January the 6th, National Health Commission briefs National Health meeting. On January the 7th, President Xi chairs meeting on the disease. On January the 8th, Chinese and US CDC leaders discuss over the phone. On January the 9th, China updated World Health Organization on coronavirus's cause of unknown pneumonia. On January the 12th, China shared the genetic sequence of coronavirus via GSAID. On January the 23rd, Wuhan went into lockdown with only 570 cases reported in China. And I want to mention these two particular ones that I find particularly important for people in the UK. On January 24th, clinical features of patients infected with 2019 novel coronavirus in Wuhan, China was published on The Lancet, okay, a very prominent medical magazine that the British are very familiar with. On January the 29th, early transmission dynamics of Wuhan, China of novel coronavirus infected pneumonia published on the New England Journal of Medicine. So the list goes on. Professor Cui, what is obstructionist about all of this, what China has been trying to do to alert the world?
If we look at this, maybe some lessons for the British government and people, how to deal with this epidemic disease. Yes, maybe one of the reasons is we can find some ignorance at the very beginning. But what's the reason for this ignorance? I think maybe the most important thing is a prejudice by some politicians, by some people about this epidemic disease. Maybe at the very beginning, some or most of the people in UK or some other European countries, they just regarded this disease is just in a Chinese
right.
style.
Well,
it will not go to Europe or some other place.
Yeah,
yes.
I believe not anymore. Many things, I have to interrupt here. Many things, we're running out of time. Alistair, Michie from the UK and Professor Cui Hongjian joining us here in Beijing. You've been watching The Point. We'll take a short break, and when we come back, China sent a team of medical experts to Serbia to help fight COVID-19. What's the situation there? I spoke to one of the team members. Stay with me.